1. A postoperative client has a prescription for acetaminophen with codeine. What should the nurse recognizes as a primary effect of this combination? A. Enhanced pain relief. B. Minimized side effects. C. Prevention of drug tolerance. D. Increased onset of action. 1A. Enhanced pain relief. Combination of analgesics with different mechanisms of action can afford greater pain relief. 2. A nurse is caring for a client who is receiving methyl-dopa hydrochloride, Aldamate, intravenously. Which of the following assessment findings would indicate to the nurse that the client may be having an adverse reaction to the medication? A. Headache. B. Mood changes. C. Hyperkalemia. D. Palpitations. 2B. Mood changes. The nurse should assess the client for alterations in mental status such as mood changes. These symptoms should be reported promptly. 3. When providing discharge teaching to a client with asthma, the nurse will warn against the use of which of the following over-the-counter medications? A. Cortisone ointments for skin rashes. B. Aspirin products for pain relief. C. Cough medications containing guaifenesin. D. Histamine blockers for gastric distress. 3B. Aspirin products for pain relief. Aspirin is known to induce asthma attacks. Aspirin can also cause nasal polyps and rhinitis. Warn individuals with asthma about signs and symptoms resulting from complications due to aspirin ingestion. 4. The nurse practicing in a long-term care facility recognizes that elderly clients are at greater risk for drug toxicity than younger adults because of which of the following physiological changes of advancing age? A. Drugs are absorbed more readily from the GI tract. B. Elders have less body water and more fat. C. The elderly have more rapid hepatic metabolism. D. Older people are often malnourished and anemic. For B. Elders have less body water and more fat. Because elderly persons have decreased lean body tissue/water in which to distribute medications, more drug remains in the circulatory system with potential for drug toxicity. Increased body fat results in greater amounts of fat-soluble drugs being absorbed, leaving less in circulation, thus increasing the duration of action of the drug. 5. In providing care for a client with pain from a sickle cell crisis, which one of the following medication orders for pain? Control should be questioned by the nurse. A. Demerol. B. Morphine. C. Methadone. D. Codeine. 5A. Demerol. Meperidine is not recommended in clients with sickle cell disease. Normeperidine, a metabolite of meperidine, is a central nervous system stimulant that produces anxiety, tremors, myoclonus, and generalized seizures when it accumulates with repetitive dosing. Clients with sickle cell disease are particularly at risk for normeperidine-induced seizures. 6. The nurse is administering diltiazem, cardizem, to a client. Prior to administration, it is important for the nurse to assess which parameter. A. Temperature. B. Blood pressure. C. Vision. D. Bowel sounds. 6B. Blood pressure. Diltiazem, cardizem, is a calcium channel blocker that causes systemic vasodilation resulting in decreased blood pressure. 7. A client with an aplastic sickle cell crisis is receiving a blood transfusion and begins to complain of feeling hot. Almost immediately, the client begins to wheeze. What is the nurse's first action? A. Stop the blood infusion. B. Notify the healthcare provider. C. Take/record vital signs. D. Send blood samples to lab. 7A. Stop the blood infusion. If a reaction of any type is suspected during administration of blood products, stop the infusion immediately, keep the line open with saline, notify the healthcare provider, monitor vital signs and other changes, and then send a blood sample to the lab. 8. A client with atrial fibrillation is receiving digoxin, lanoxin. Which of these assessments is most important for the nurse to perform? A. Monitor blood pressure every 4 hours. B. Measure apical pulse prior to administration. C. Maintain accurate intake and output records. D. Record an EKG strip after administration. 8b. Measure apical pulse prior to administration. Digitoxin decreases conduction velocity through the AV node and prolongs the refractory period. If the apical heart rate is less than 60 beats/minute, withhold the drug. The apical pulse should be taken with a stethoscope so that there will be no mistake about what the heart rate actually is. 9. The nurse is caring for a 10-year-old client who will be placed on heparin therapy. Which assessment is critical for the nurse to make before initiating therapy? A. Vital signs. B. Weight. C. Lung sounds. D. Skin turgor. 9b. Weight. Check the client's weight because dosage is calculated on the basis of weight. 10. The use of atropine for treatment of symptomatic bradycardia is contraindicated for a client with which of the following conditions? A. Urinary incontinence. B. Glaucoma. C. Increased intracranial pressure. D. Right-sided heart failure. 10b. Glaucoma. Atropine is contraindicated in clients with angle closure glaucoma because it can cause pupillary dilation with an increase in aqueous humor, leading to a resultant increase in optic pressure. 11. The healthcare provider orders an 4-aminophylline infusion at 30 mg per hour. The pharmacy sends a 1,000 ml bag of D5W containing 500 mg of aminophylline. In order to administer 30 mg per hour, the RN will set the infusion rate at A. 20 ml per hour. B. 30 ml per hour. C. 50 ml per hour. D. 60 ml per hour. 11d. 60 ml per hour. Using the ratio method to calculate infusion rate, mg to be given, 30 ml to be infused, x mg available, 500 ml of solution, 1000. Solve for x by cross-multiplying. 30 times 1000 is equal to 500x, or cancel. 30,000 is equal to 500x, x equals 30, 000/500, x equals 60 ml per hour. 12. The nurse is applying silver sulfadiazine, Silvadine, to a child with severe burns to arms and legs. Which side effect should the nurse be monitoring for? A. Skin discoloration. B. Hardened eschar. C. Increased neutrophils. D. Urine sulfa crystals. 12d. Urine sulfa crystals. Silver sulfadiazine is a broad-spectrum antimicrobial, especially effective against Pseudomonas. When applied to extensive areas, however, it may cause a transient neutropenia, as well as renal function changes with sulfa crystals production and kernicterus. 13. The nurse is caring for a client who is receiving procainamide, Pronestil, intravenously. It is important for the nurse to monitor which of the following parameters? A. Hourly urinary output. B. Serum potassium levels. C. Continuous EKG readings. D. Neurological signs. 13c. Continuous EKG readings. Procainamide, Pronestil, is used to suppress cardiac arrhythmias. When administered intravenously, it must be accompanied by continuous cardiac monitoring by ECG. 14. The nurse is teaching a parent how to administer oral iron supplements to a 2-year-old child. Which of the following interventions should be included in the teaching? A. Stop the medication if the stools become tarry green. B. Give the medicine with orange juice and through a straw. C. Add the medicine to a bottle of formula. D. Administer the iron with your child's meals. 14b. Give the medicine with orange juice and through a straw. Absorption of iron is facilitated in an environment rich in vitamin C. Since liquid iron preparation will stain teeth, a straw is preferred. 15. A client with bipolar disorder is taking lithium, lethine. What should the nurse emphasize when teaching about this medication? A. Take the medication before meals. B. Maintain adequate daily salt intake. C. Reduce fluid intake to minimize diuresis. D. Use antacids to prevent heartburn. 15b. Maintain adequate daily salt intake. Salt intake affects fluid volume, which can affect lithium, lethine, levels, therefore, maintaining adequate salt intake is advised. 16. The nurse is assessing a 7-year-old after several days of treatment for a documented strep throat. Which of the following statements suggests that further teaching is needed? A. Sometimes I take my medicine with fruit juice. B. My mother makes me take my medicine right after school. C. Sometimes I take the pills in the morning and other times at night. D. I am feeling much better than I did last week. 16c. Sometimes I take the pills in the morning and other times at night. Inconsistency in taking the prescribed medication indicates more teaching is needed. 17. An elderly client is on an anticholinergic metered dose inhaler, MDI, for chronic obstructive pulmonary disease. The nurse would suggest a spacer to A. Enhance the administration of the medication. B. Increase client compliance. C. Improve aerosol delivery in clients who are not able to coordinate the MDI. D. Prevent exacerbation of COPD. 17c. Spacers improve the medication delivery in clients who are unable to coordinate the movements of administering a dose with an MDI. 18. The nurse is providing education for a client with newly diagnosed tuberculosis. Which statement should be included in the information that is given to the client? A. Isolate yourself from others until you are finished taking your medication. B. Follow up with your primary care provider in 3 months. C. Continue to take your medications even when you are feeling fine. D. Continue to get yearly tuberculin skin tests. 18c. The most important piece of information the tuberculosis client needs is to understand the importance of medication compliance, even if no longer experiencing symptoms. Clients are most infectious early in the course of therapy. The numbers of acid-fast bacilli are greatly reduced as early as 2 weeks after therapy begins. 19. The nurse is administering an intravenous vesicant chemotherapeutic agent to a client. Which assessment would require the nurse's immediate action? A. Stomatitis lesion in the mouth. B. Severe nausea and vomiting. C. Complaints of pain at site of infusion. D. A rash on the client's extremities. 19c. Complaints of pain at site of infusion. A vesicant is a chemotherapeutic agent capable of causing blistering of tissues and possible tissue necrosis if there is extravasation. These agents are irritants which cause pain along the vein wall, with or without inflammation. 20. The nurse is instructing a client with moderate persistent asthma on the proper method for using MDIs, multi-dose inhalers. Which medication should be administered first? A. Steroid. B. Anticholinergic. C. Mast cell stabilizer. D. Beta agonist. 20d. Beta agonist. The beta agonist drugs help to relieve bronchospasm by relaxing the smooth muscle of the airway. These drugs should be taken first so that other medications can reach the lungs. 21. The nurse is teaching a group of women in a community clinic about prevention of osteoporosis. Which of the following over-the-counter medications should the nurse recognize as having the most elemental calcium per tablet? A. Calcium chloride. B. Calcium citrate. C. Calcium gluconate. D. Calcium carbonate. 21d. Calcium carbonate. Calcium carbonate contains 400 mg of elemental calcium in 1 gram of calcium carbonate. 22. The provider has ordered daily high doses of aspirin for a client with rheumatoid arthritis. The nurse instructs the client to discontinue the medication and contact the provider if which of the following symptoms occur. A. Infection of the gums. B. Diarrhea for more than 1 day. C. Numbness in the lower extremities. D. Ringing in the ears. 22D. Ringing in the ears. Aspirin stimulates the central nervous system, which may result in ringing in the ears. 23. 5-year-old has been rushed to the emergency room several hours after acetaminophen poisoning. Which laboratory result should receive attention by the nurse? A. Sedimentation rate. B. Profile 2. C. Bilirubin. D. Neutrophils. 23C. Bilirubin. Bilirubin, along with liver enzymes ALT and AST, may rise in the second stage, 1 to 3 days, after a significant overdose, indicating cellular necrosis and liver dysfunction. 24. The nurse is caring for a client with schizophrenia who has been treated with quetiapine, Seroquel, for 1 month. Today the client is increasingly agitated and complains of muscle stiffness. Which of these findings should be reported to the healthcare provider? A. Elevated temperature and sweating. B. Decreased pulse and blood pressure. C. Mental confusion and general weakness. D. Muscle spasms and seizures. 24A. Elevated temperature and sweating. Neuroleptic malignant syndrome, NMS, is a rare disorder that can occur as a side effect of antipsychotic medications. It is characterized by muscular rigidity, tachycardia, hyperthermia, sweating, altered consciousness, autonomic dysfunction, and increase in CPK. This is a life-threatening complication. 25. A client is receiving dexamethasone, Decadron, therapy. What should the nurse plan to monitor in this client? A. Urine output every 4 hours. B. Blood glucose levels every 12 hours. C. Neurological signs every 2 hours. D. Oxygen saturation every 8 hours. 25B. The drug Decadron increases glycogenesis. This may lead to hyperglycemia. Therefore the blood sugar level and acetone production must be monitored. 26. The nurse is teaching a child and the family about the medication phenytoin, Dilantin, prescribed for seizure control. Which of the following side effects is most likely to occur? A. Vertigo. B. Drowsiness. C. Gingival hyperplasia. D. Vomiting. 26C. Swollen and tender gums occur often with use of phenytoin. Good oral hygiene and regular visits to the dentist should be emphasized. 27. A newly admitted client has a diagnosis of depression. She complains of twitching muscles and a racing heart, and states she stopped taking Zoloft a few days ago because it was not helping her depression. Instead, she began to take her partner's Parnate. The nurse should immediately assess for which of these adverse reactions? A. Pulmonary edema. B. Atrial fibrillation. C. Mental status changes. D. Muscle weakness. 27C. Mental status changes. Use of serotonergic agents may result in serotonin syndrome with confusion, nausea, palpitations, increased muscle tone with twitching muscles, and agitation. Serotonin syndrome is most often reported in patients taking 2 or more medications that increase CNS serotonin levels by different mechanisms. The most common drug combinations associated with serotonin syndrome involve the MAOIs, SSRIs, and the tricyclic antidepressants. Philadelphia, Saunders. 28. A client has been receiving dexamethasone, Decadron, for control of cerebral edema. Which of the following assessments would indicate that the treatment is effective? A. A positive Babinski's reflex. B. Increased response to motor stimuli. C. A widening pulse pressure. D. Temperature of 37 degrees Celsius. 28B. Decadron is a corticosteroid that acts on the cell membrane to decrease inflammatory responses as well as stabilize the blood-brain barrier. Once Decadron reaches a therapeutic level, there should be a decrease in symptomology with improvement in motor skills. 29. The nurse is assessing a client who is on long-term glucocorticoid therapy. Which of the following findings would the nurse expect? A. Buffalo hump. B. Increased muscle mass. C. Peripheral edema. D. Jaundice. 29A. Buffalo hump. With high doses of glucocorticoid, iatrogenic Cushing's syndrome develops. The exaggerated physiological action causes abnormal fat distribution, which results in a moon-shaped face, an intrascapular pad on the neck, buffalo hump, and truncal obesity with slender limbs. 30. A client is ordered atropine to be administered preoperatively. Which physiological effect should the nurse monitor for? A. Elevate blood pressure. B. Drying up of secretions. C. Reduce heart rate. D. Enhance sedation. 30B. Drying up of secretions. Atropine dries secretions which may get in the way during the operative procedure.